Hi friends, today we are going to discuss about the Sata question. If the Sata question scares you, this video is especially for you. And this Sata rules act alone can increase your score to a greater extent. And if you are always stuck in the priority and it fears you, and this is the right video for you. By the end of the video, you will never miss how to solve the Sata question. So let's go to the video. I'm going to walk you through with a few sample questions. A nurse is caring for a multiple clients on a medical surgical unit. Which client requires immediate nursing intervention? Select all that apply. So the options here are a client with COPD who has SpO2 of 88 on room air and it's speaking in full sentences. And B, a post-thyroidectomy client with a hoarse voice 2 hours after surgery. And option 3, a client with DKA whose blood glucose decreased from 520 deciliter to 260 milligram per deciliter in 2 hours. And option D, the client with chest tube draining 250 ml of sanguineous fluid in the last hour. And option E, a client receiving IV potassium who reports burning at the IV site. And option F, a client with sepsis who is suddenly confused and restless. And option G, a client with heart failure who has 3+ bilateral pedal edema. So among all these options, we need to select which is the correct option which is given in the question. So why students fail in such type of question is that they always choose the SpO2 over the airway signs, right? And they also panic, okay, edema, it's instead of bleeding, and they ignore the sudden mental status change from the question and in the options. So the correct answer here are the B, D, E and F, where the hoarseness post-thyroidectomy immediately after 2 hours, and the chest tube draining of sanguineous fluid of 250 ml per hour, and the burning at the IV potassium site and sudden confusion in sepsis patient. So these are all the right answers, and I am going to tell you why these answers are right. So airway, B, that is the airway threat. Hoarseness of voice post-thyroidectomy indicates there might be a laryngeal edema after the surgery, and possible obstruction may be a signal. Because of that, the patient is producing hoarseness. And here always this airway beats the oxygen numbers which is given in the saturation, right? And the option D, that is a circulatory emergency. So when a chest tube normally should drain certain amount of ml only, but if it is suddenly increasing in the blood amount, that is more than 100 ml, that is 250 ml, which is saying in the question, which indicates active bleeding, that is, and patient might be in a risk of shock. So this is also an important priority. And option E, which is saying the tissue necrosis risk, that is IV potassium is vesicant and burning, so it causes infiltration. We need to check the IV site. This is immediate priority because the patient vein might go into necrosis, right? And option F, which is again correct, is perfusion issue. So if there is altered mentation, so there might be changes in the mental status. So because of the decreased blood supply to the cerebral perfusion, that might be because of initial stages of sepsis. So all these options are right option. Now I am going to say why the other options are not correct. So we can see here how the NCLEX has shown the priority logic and applied here, where we have seen that the option A, that is expected, it is not immediate, right? The saturation of 88 to 99 is expected in COPD patient, and we have found from the option that the patient is speaking normally, which implies that the patient's airway is intact. And the option C, which is again wrong, is because it is a desired response. Once the glucose is reducing, it indicates the treatment is effective. There is nothing to alarm, right? And the option G, which is again is wrong, is because of the chronic finding. Edema is expected in heart failure patient, but it is not an immediate threat, or it is not the option is not saying the patient is having any breathing difficulty of such. So this is also not the priority. So the golden priority, what we should always memorize this is, if there is any sudden changes which is going to increase priority, and a chronic condition doesn't cause much priority. And we have to see for the lab trends and the expected findings. Always the sudden change goes with the highest priority, right? And what is the exam takeaway from this question is, NCLEX does not ask which is right, which is wrong, right? And it always assesses the which patient is the most sickest, right? So we should always think in such a way that which patient is going to die first if you're not going to take the action at the right time. Okay, thank you friends.